Um, it was clear that we needed something more than just a hotline and something more than a bunch of volunteers at the gay clinic to try to handle the response. And so I happened, because of my placement within the public health department, I was, able to be in a place where I could suggest models for a clinic or some kind of activity that would help people who were worried, who didn't have ongoing medical care, but who could go to get physical exams, as well as the hotline. So we sort of cobbled together a budget and a brief proposal for what became the AIDS assessment clinic. And the way we got funding for it was that we went first to the Seattle City Council, and some of us knew people who were staff of council members, etc. And I went to Tom Byers, who was the deputy mayor at that point, who was the founder of Country Doctor Clinic. So he was very sympathetic to what we were doing at Seattle Gay Clinic, and asked him for advice about how could we get money from the Seattle City Council to help put together some kind of an AIDS assessment clinic. And so I wrote a budget, and Tom showed it around to people, and eventually it got passed on to a couple of key city council members, Norm Rice, who later became the mayor, and Jack Richardson, who had been a Republican fire chief. Many people thought he was very conservative and might not be open to doing anything about AIDS, but we were wrong. He was very sympathetic, and he was in charge of the finance committee. And he got behind this idea of coming up with funding, one, to pay for the hotline, to actually pay for a person to answer the hotline, and to pay for a nurse practitioner to staff an assessment clinic. And we suggested nurse practitioner because I'd worked a lot with nurses and nurse practitioners and physician's assistants in the public health department and had great respect for them, realized that not only, were they less expensive than hiring a doctor, but they could do very high quality service in terms of giving a full physical exam to people who were worried.